Welcome to the World Health Network International Call. Today we have a special guest, Matti Heino from Finland, a social psychologist and researcher who's advising the Finnish government on policymaking. Today, Matti will talk to us about preparedness for the COVID-19 pandemic and his experience with health psychology and behavioral medicine. We are so excited for you to have joined us today, Matti, and look forward to your presentation. Thank you.
Thanks, Katie. So let me do the screen share. Yes. All right. So, hey, welcome everyone. Happy to see you all. So, just to illustrate the unpredictable nature of human life, I changed the topic from what the headline from what I saw in the promo materials. I hope you'll enjoy it as much as I did. So a couple of words about me. I'm working in the University of Helsinki. I've been working in research projects regarding health psychology and behavioral medicine. So what we did pre-pandemic was think about the lifestyle diseases and how to counter those. So, for example, if people want to change their behavior to become more active, to avoid type 2 diabetes or something like this. So we were studying how people can change their behaviors and self-manage their motivation and all of that. And then one project we recently finished was called Behavior Change Science and Policy, where we gathered scientists from interdisciplinary fields dealing with human behavior and tried to make contacts with policymakers, and so we had a series of symposia for this. And then since 2020, I've been part of this behavioral science advisory group to the Finnish government, and also a pandemic prevention project where we have a multidisciplinary team. So we're working with physicists and engineers who study materials and airflows and stuff like this. And then we have a team of social psychologists who study what actually makes people carry out protective behaviors and use these devices that are supposed to help mitigate contagion. So yeah, those are just a couple of websites. But before I go on, I would actually like to ask, what do you guys think? What are some things that affect behavior? There's the box in the bottom of the screen you can type in. So what causes behaviors and changes in behaviors? What affects when a person decides or is able to carry out a lifestyle change or a change in their behavior? Consistency, yes. So habits, ease, yes, definitely. Peer pressure, social stuff, social norms, fear, definitely. Community pressure, excellent. Yeah, so often fear, in order for fear to change behavior, you need actually to also be able to know how to counter that fear. Gaslighting is, yes, I enjoyed that especially. So what we have in health psychology and behavioral medicine, what we often do is we try to categorize things, and we try to sort of create a holistic picture of a phenomenon by trying to find out the concepts and things and catalog many things in order to be able to speak about that and to understand, okay, so what is the big picture of that behavior. And we have one of the catalogs that has been created. It's called the Theoretical Domains Framework. So these are just, if you're in physical sciences, you might just want to keep in mind that these are not ontologically true categories, but they are just useful ways of trying to figure out what are all the kinds of things that affect behavior. So when you speak to decision makers or policy makers, they often in their palette, they many times they speak about, okay, so how knowledge is important. So you need to give people the right information, and that will hopefully make people change behavior. And that's the same thing with the doctor's consultations. So doctors often have this implicit idea that if I tell a person they're going to die if they keep on smoking, well, obviously they're going to stop smoking. And of course, everyone knows that this isn't necessarily how it works. So, but knowledge is one category. Then we have skills, different things going under skills, emotions, fear, anxiety, stress, cognitive processes regarding attention, memory, decision making. And then these groups that we consider to be a part of. So we're a part of this group. We're definitely not a part of that group. And not only the actual skills, but beliefs about what is it that we can do and what we can't do in our environment. And then regarding this, maybe also the optimism, pessimism, beliefs about what happens if I do something, or if I change my behavior. Reinforcements are sort of related to this Pavlovian conditioning thing. You remember the dogs and the bells. And then intentions and forming intentions may change behavior or affect it. Goals, the goals we create, whether they're realistic, and how we pursue those goals, which we call like behavioral regulation. So you can make plans and or just hope for everything to go the right way. And then maybe I consider these maybe the most important ones, which are the social influences and also the environmental context. So what are the behaviors that the environment allows us to do, and what is it that they constrain us from doing? And the social and environmental influences often work together in a feedback loops, and you can also think about like different feedback loops. So when you successfully perform a behavior, then maybe you get a positive emotion, you get encouragement to keep on doing the behavior. Maybe your beliefs about the consequences of the behavior change, maybe they get reinforced, and you can create more efforts to change the behavior, talk to your friends and neighbors, and they will further reinforce the behaviors. And so we can create these loops that keep us in momentum. So just to give an example, of course, this is there because there's such a huge bulk of things that can affect behaviors. You of course have to choose something to focus on. And what we did, just as an example, last fall, was that there was this rhetoric in Finland, and a lot of media was saying that people are sick and tired of restrictions, so we need to get rid of restrictions, which is basically all protective measures. So what we wanted to know was, okay, so if this is true, who are the people? Are they a homogeneous category? What does it mean to be sick of something or tired of doing something? And is that something, the restrictions, is that actually a homogeneous category that you can just say, oh, people don't like this, so we need to get rid of this category. Or is that category something that consists of many different behaviors? So what we did was we interviewed people and we conducted surveys, and uh, we asked people about how effective they would feel that these protective measures are, how easy or difficult it would be to do those, and how long would they persist in doing the behavior if it was warranted. And what we found out was that basically restricting close social contacts was the most annoying thing for people. And of course, self-quarantining for an extended period if you don't have a positive result. So these were sort of the things that we identified that need to be addressed and maybe facilitated in some way. Whereas, for example, masks in public spaces, people were very positive about those. And also, we were quite surprised that, so we were probably the first ones in Finland to talk about this community contact tracing. So you call the people you have met after you, like in the previous week, after you have learned that you have a positive result, and people were like super positive about this. And even the ones who were very skeptical about COVID, they didn't see any obstacles to like telling people that they have received a positive test if that was. And there's also an if that is recommended by some health authority. So there's a lot of power, at least in Finland, with this sort of recommendation that's not a mandate, but a recommendation, and people really look to the health authorities to give these recommendations or not. Home tests weren't very big back then, end of last year in Finland, but since then we have seen that, okay, so after people had started doing this because our testing system essentially fell apart with Delta and Omicron. So when people started home testing, this has become much more acceptable. It has gone into sort of this category. But another problem category we saw was the air hygiene measures. So people really didn't see the connection between ventilation, air purification, and spread of COVID. And this is something we see in often in crisis situations. What people do is they sort of stick to the information they get at the beginning of the crisis, and it's very hard to change minds after that. And so what we have been trying to push is for extended communication about the airborne precautions, because we know that people are not as aware of those as they are of other important points about mitigating spread. And so this idea where you tell everyone that the people, oh, by the way, the people, in this case, the people who were sick and tired of precautionary actions, they were mostly young people living in cities. So there's also a demographic divide in there. But when you say that the people are sick and tired of restrictions, you're sort of making a statement. If you haven't done any research to base that statement on, you're making a statement purely on the mental model you have, which can be stemming from your personal experiences, which is it's not worthless, and the experiences of your own social circle are not worthless, but it's very difficult if you impose those onto the whole population, especially if the population is diverse. So the problem of mental models and the opportunity also, or the fact of it, because there's really no way around them, is that we have this some sort of raw reality. which has a lot of detail, a lot of nuance, a lot of contextual cues, and it contains a lot of information. So in order for us to communicate some part of this reality, what we do is we sort of take the reality and run it through a filter of sorts. And this filter consists of our preconceptions, some classifications, mental or mathematical models, and then we end up with some explicit knowledge, which can be transmitted by research papers or policy briefs or things like this. And whether this explicit knowledge we are delivering, whether it matches the reality, it depends on what are the important facets of the reality. So in this case, for example, if the important facets of this reality for this particular context are that there is a person sitting, then we are transmitting a very faithful image or a model of that reality, although we are skipping a lot of the detail. But if the important thing about this reality is that this person is reading, for example, then we're missing the whole thing. And this matters in many ways. So, for example, we know that we have these different kinds of systems. And sometimes we want to treat all of these as just, okay, so a system is a system is a system. But on the other hand, these systems, they differ very much from these ones. So for example, once you have learned how to build a system like this and make it run the way you want, it's very likely that you can do the same thing following the same instructions you had or the instructions that someone else had, and you do it over again and you get the same results. Whereas in these systems, when you do something and you do it the second time and you do it the third time, if every time you are insisting that you need to get the same results, that's actually the definition of insanity, maybe. And if you don't believe me, try telling a person the same joke twice in a row. And so mixing these two things up is sort of mixing the model with reality in a way that can be very harmful. And one way that it can be, in this particular case, can be harmful is that if you think that, okay, so you have a mechanistic model of the society or the person, you might want to impose mechanistic metaphors on how to control that behavior. So, for example, a joystick, everyone knows that it would be ridiculous to think that people could be controlled by a joystick in a way that a robot could be. But on the other hand, it's not that far-fetched that in many organizations we have a dashboard that has all these key performance indicators and all these things we can so we can push there, pull here, and draw here, and then things start changing, and we can sort of control the organization with this dashboard like we could a very sophisticated aircraft. And this can go wrong very badly because most of the connections are not actually connected anywhere. So another metaphor is, or a mental model could be one of a DJ, where you don't have sort of causal control of the actual things that happen, but you sort of incentivize. So you put on music and people come on the dance floor, and you don't control what the people do, but you can control the kinds of things they do by playing different music and stopping the music and all that kind of stuff. So there is sort of causal force in your dashboard here, and I think this is a little bit closer to the truth, but it's still quite there's an arrogant factor in this, saying that the people don't have much will except for you to be the piper, and they do the whatever they do. And so one thing how this could go wrong, for example, is that if you have that sort of a mentality and you come across this idea, which is very common in living systems, that so in sort of traditional engineering thinking, you can the more effort you put in, the better results you get. But then on the other hand, in many walks of life, you can put in a lot of effort, and you put in more and more effort, and nothing seems to happen. Nothing seems to happen until at some point everything starts happening, and very little effort brings you very big results. And another way to think about this is think about the ProVerbal Camel, and you load a straw on the camel's back, another straw, a third straw, and you keep on loading the camel's back until at some point the back breaks, and then some researcher runs to the scene and starts analyzing the last straw that broke the camel's back, and looking at, okay, so what are the special back-breaking capabilities of this particular straw? Which is, of course, lunacy, because in this example, we know that it was the process, the accumulation, that actually created the final event. But all the events that led to the final event were of equal force, so to say. They were all the same, but they created a different outcome. And this is, all, again, about the mental models you think that are possible. So one way to think about this is to go from thinking about, okay, so what causes this behavior, to thinking about, okay, so what are the catalysts of this behavior? So I like this comic because I think it is quite a nice metaphor of how human behavior and how social change happens. So in this case, one begins wondering, like, okay, so if this person eventually gets a pear that is picked up from a tree by this arm here, is the cause of getting the pear, is the cause putting a coin in the machine, is the cause that the machine, all the parts of the machine work, or is the pear caused by the water and sun and all of that, or that there were enough components that this thing could be built in the first place, or someone had the idea, or the boundary conditions of the universe. But you can see that it quickly, the sort of billiard ball causality, the intuitive kind of causality, it just breaks down when you consider how many things affect the processes that we are dealing with in this practical world of social life. And one thing why this matters is that these things cause you to expect different things. So, for example, we call this the panic myth, which is very prevalent in decision makers and also in rescue officials who ought to know the best. But thing is, it's called the panic myth because many disaster movies depict humans as these simple creatures who, when they get too worried, they lose control and they go crazy and they start looting and they start trampling and all of that kind of stuff. Whereas in reality, when you look at studies of different disasters and crises, what people usually do is that they help each other. They act very rationally and calmly, unless it's actually a very constrained situation where you have a small room or a big room, and there's a fire or something, and a very small door. So that's an exception, not the rule, and that's why we've been telling decision makers a lot to actually focus on giving the right information so that people can self-organize their own actions based on the correct information, and not worry that much on whether that information will worry people, but focus more on whether or not the information contains a call to action. So what can the person do to mitigate that threat? I mentioned the panic earlier. So I mean the fear earlier when we were listing things. So you want to give people something that they can do to mitigate the threat. Otherwise, they can just become very gloomy and lose sort of their autonomy. And that's, I think it's a horrible shame that we have seen this trend that health officials are telling people that there is no way of avoiding infection. And by the way, we are encouraging people to stop the healthcare system from collapsing, but we're not actually imposing restrictions. So you use your own decision making, but you can't avoid contagion. And this is sort of the worst situation you can put people on. You tell them that there's nothing you can do, and I think that is very very bad. But so another perspective is this like large scale social change, and I've drawn in green here the mask wearing in Finland over time. So it starts in 2020, and here in dotted line I have the sort of the mental model of the health officials pre-pandemic. So what was considered was that we don't need to really prepare for large-scale mask wearing that much, because it's actually impossible for people to take up mask wearing and perform these large-scale behavior changes, that they stop meeting, that there's this new pandemic threat and people stop meeting other people, and they do a very collaborative effort to like even before lockdowns are imposed, they reduce their mobility and they wear masks and so forth. So we have this gap between the reality and the mental model here. And it sort of gets worse if you want to predict social change for a very long time period, because there's this famous saying in social psychology that even a small group of people can actually create drastic change. And often that change happens in sort of this way that you already saw, that for a very long time there is nothing happening, and then suddenly everything starts happening at once. And I'm gonna end with this super simple, maybe the simplest model of behavior that we have available, that is also sort of comprehensive. So it's called the capability, opportunity, motivation, behavior model, so COMBI. And don't worry about the arrows. And again, this is not a depiction of the ontologically true landscape. It's a way of thinking and making sure that you are actually, when you're thinking about a problem, you're actually thinking it about in more than one way. So the idea is that basically that in order to ride a bike, you need to be able to ride a bike. You need to know how to ride a bike. You need to want to ride a bike, and you need to have a bike available. And it's basically that simple. We can break these down into physical and psychological capability, automatic and reflective motivation, and the social and physical opportunities. I won't go too deeply into this, but it's just to point out that, for example, in the UK, when they had this, they identified the problem that when there was a lockdown and people were not adhering, and so they immediately went to the idea that, okay, so this is a motivation problem, and actually a reflective motivation problem. So people are thinking, oh, I don't want to do this, and then they stop following the rules. Whereas for many people who didn't do it, the solution was to fine people, to impose a fine that you will have to pay money if you don't, if you get caught. But the problem was that a lot of the problematicity in this breaking the rules was related to physical opportunities because people couldn't afford food if they didn't go to work. And so you could have actually, if you would have spent a little more time thinking about, okay, so what else could this be about instead of just the motivation part, and then you might have noticed that, okay, so actually maybe we have other ways to counter this behavioral problem than just putting in the knee-jerk response of fining people for non-adherence. So just a few one example of each of these. So if we think about what matters when a person is whether a person wears or doesn't wear an N95 when they go in a public space, for example. So physical capabilities can relate to whether the person can put the mask on properly. Psychological capability example of that would be that the person remembers to take the mask with them so that when they're entering the public space, they actually have a mask to put on. Automatic motivation, this is the sort of emotional category, so it feels comfortable. You don't feel that you're losing oxygen or getting anxiety from it. And reflective motivation is about, so for example, efficacy beliefs. You believe that it makes sense to actually do the behavior. Social opportunities, that norms that other people are okay and don't think that, okay, so you're signaling disrespect by wearing a mask, but instead that you're being caring about others. And physical opportunities, that it's inexpensive or you can get them freely from somewhere. So these are just examples of each of these. And just to again point out that this is, again, it's a model, and sometimes people get lost when they weigh all of these the same, whereas what you might want to do is maybe focus on the opportunity category first, because that can actually create these feedback loops that let automatic and reflective motivation and capability grow once it's actually possible and reinforced by other people. Yeah, so that was all I had for today. And just if I want to leave you with something, it's that never underestimate the power of human ingenuity. And it's really, it's somewhat of an arrogant statement to say that some behavior is actually impossible, and to in that sense just close it down from the space of possibilities. Yes, thank you. Yeah, so I haven't been able to follow the chat at all because I was in the screen sharing mode.
Well, that's okay.
Katie.
I'm happy to read you the questions. So thank you so much for that presentation. That was great. So just so all of the participants here know, on the side, I direct your attention to the chat icon in the upper left. It'll open up and toggle open the chat bar. If you have a question for Matti, please drop it in, and I will read it off. And at that point, you can come off mute and you can have a discussion with him. So I will start here with Michelle's question. Michelle Lutzik from Make Good Together comments, group social behavior and behavioral psychology plays a critical role in how society reacts to global catastrophes, especially in events where everyone's participation is necessary to get to the end goal. Do you believe governments and authorities are using these tools in how they structure and deploy instruction for community responses? Do you feel we have been successful or unsuccessful in leveraging these disciplines? There's another question, but I will stop there so you can take those in.
Yeah, so a recent project that we actually released the report, unfortunately, in Finnish today, was about crisis behaviors, because we are next door to Russia. The Ukraine crisis really touched many of our many people here, and so we did this research similar to the COVID research, where we did surveys and then interviews, and it was quite interesting because we also were collaborating with this rescue organizations and officials about what sort of questions should we ask. And it was interesting because I was surprised to see that, okay, so there is actually this idea of the panicky individual and the fragile individual, although everyone agreed that it's they have a concept called community as first responders. So whenever if you have a fire and you go there, and if you have a some medical emergency, there is already people there when you get there with your rescue services. And so I think I don't know why, and it might be that I'm not just I haven't yet gone deep enough into this field, but it seems that there are a lot of ways that we could improve on this community first response, and not only of course for fires or pandemics or anything, but we know that people have a lot of these sort of myths about what happens when electricity goes out, and people really think that the shops will stay open for days and then they have time to prepare, whereas in all countries the officials actually encourage people to prepare for, the timeline depends, but at least 3 days to be prepared to be on their own. And so but what we would ideally want to do is give people the right information and the things that they can do, and the social networks that they can that they get. Maybe they can start prepare this sort of disaster preparedness that's anyway an important thing to do, and to prepare for electricity outages and stuff like this. That so when people are doing that, I've been thinking that that could be a bridge to get to know your neighbors, because the worst situations are in large cities where you don't know your neighbors. And this was the same with COVID, because you don't have the sense of community, and your community might be completely online. And if you need someone to help you with to get stuff from the store, the person from Brazil is unlikely to come and help you with that, although it's great that we have these international online connections. So I think this is something to be strengthened and to be elevated, this resilience that's embedded in these social networks. So even if you wouldn't know anyone who knows what's going on, or who could help in doing something, people usually could know someone who knows someone who knows what to do. And so in that sense, it lessens the dependency on a functional communication channel with the official rescue officials or health officials or something like this, if there is a new pathogen, for example.
Okay, thank you. The second part of the question, you may have already addressed some of it, but I will read. And in which ways can authorities better leverage the science from group social behavior and behavioral psychology to help yield more effective responses with more ideal outcomes?
Yeah, I think this is a huge question. I think about this every day, and I hope I would wish I had the magic bullet, but yeah, we're working on it. Yeah, I think the first step is to start thinking about, okay, so is this the reality? or is this a mental model, or is this a model? Bless you. Uh, so I think one of the first things to do is actually to recognize that this is an assumption or presumption, and it's not a reflection of the truth until we actually get data to back these things up. Because yeah, and I don't mean that everything should be evidence-based, and we have a very good decision frameworks based on the precautionary principle and all of that. But it should, when you are sort of arguing for less precautions in an arguably dangerous situation, then you should actually, I think then it would be helpful if you would actually provide other arguments than this is what I think and this is what people around me are saying.
All right, thank you. Our next question is from Chloe regarding panic about what about that fire alarm experiment where people not only didn't panic, they didn't even respond to the fire alarm.
Yeah, I think this is partly about the importance of the meanings we give to different things. So in this sense, if you give if people attach the meaning that this is a drill, there's nothing to worry about, this can't happen. If they attach that meaning to a cue, such as fire alarm, bad things can obviously come out. And another example of the problem in meanings is is masking or vaccination, when some people attach the meaning of this is a fascist enterprise trying to strangle me. And when people attach that meaning to the protective behavior, it becomes very hard to actually have any discussion about that. And when the public health officials are like, oh, hey, we'll make this really easy for you, but if you have that sort of meaning, and if the lawmaker is that we will make you do this, and if you have that meaning, then you can just dig in your heels. So we call this the reactance. The idea of reactance, that the more you get pushed, the more you push back. And it's sort of related to something that's called the self-determination theory, which argues that people need to have a sense of autonomy for the things they do in their life, and they need to have a sense of capability, that they know what they are, how to do those things, and a sense of relatedness, so that they actually can or approved by other people for doing that. And when people have those three factors, they are more likely to actually be autonomously motivated and intrinsically motivated to perform a behavior, contrasting to when people are doing something big. So everyone probably has had a colleague who who did their job just to pay off their mortgage or something like this. And so a person who's just in it for the pay, and the quality of their work is very different from that person who is really enthusiastic and who's sort of doing it for the cause. So that's the difference between autonomous and controlled forms of motivation.
Okay, thank you. So we have a question, or more of a comment from Jonas. He says in Germany, there were some people who were talking up something called cave syndrome after the pandemic, but it seemed as though that may have just been a reason to get people to get behind Freedom Day.
So is this cave syndrome something that people can't make decisions anymore after they have been locked in a cave for too long? I'm not sure. Maybe.
Perhaps. I haven't heard of that particular phrase either, but Jonas, you can come off mute and explain that a little bit better if you'd like to. Something. Okay, he said something like that. Okay. We can move on to Vincent Brunch. So he says, with respect to the last model, which I'm not sure what last model that references, but have you made some analysis quantifying the differences between countries for these factors? Vincent, do you care to?
I think if I understood correctly, this related to the capability, opportunity, motivation model, and how that has so. One major problem is that every country is collecting their own data and they are asking their own questions in their own ways. So this has there are some data sets that have been collected across countries and that have for which the countries are sort of comparable, but those get obsolete very fast. So if your data was from the previous wave, it might not be worth anything in this wave anymore. So so the problem about analyzing across countries is that all the behavioral teams advising governments, they are working on the sort of day-to-day nitty-gritty stuff and trying to make decisions for their own country. And then we have the researchers who are doing research, and they're if someone is analyzing these countrywide differences, they will find them and they will be published somewhere during the next 3 years when things are very, very, of course, very different already. So one thing that's been interesting has been so the population of Facebook, University of Maryland has been using the population of Facebook to collect this global data set, which is, the questions are not stupid. So I think that is actually a very good merit that, because some questionnaires are very so you can interpret them in the questions in many ways, and you don't know what the response actually means when you're trying to analyze it. So, but that data you could use to look at the differences between countries. But the problem is that they are now giving it up too, and so we're losing. And they collected data every day, and that made possible very interesting analysis of like nonlinear time series analysis and all of that. But it's going to be ending soon, and we will lose that too. But something I wanted to say about this. Yeah, well, I think it's very difficult to make the inter-country make inferences about the inter-country differences, because there are so many contextual factors that feed into this data. And that's why, for example, because people always say that, oh, I don't want to come up with the wheel. And the problem in social settings is that you usually need to come up with the wheel, but you might not have to come up with the way you come up with the wheel. So you might be able. So we've copied a lot of things, like how things were how useful things were uncovered in, for example, in the Netherlands and other countries, but we were copying the ways that they collected information, and but we can't really copy the inferences they made from the information and the applications that they used those inferences for. So there's a sort of difficult bridge to cross. Mm. And of course, if you do like proper quantitative scientific work like Janir does, that focuses on like these sort of large scale underlying currents and these actual sort of more fundamental things, I think that's a very different ordeal then.
Sure. All right. Thank you. So we have a question from Todd Woodward. He confesses that he's the designated stupid question asker, but I wouldn't agree with that statement. He asks, what is about that switch in people in society where, as an analogy, people take antidepressants, and because that makes them feel better, they no longer take the antidepressants. So in terms of COVID, mitigations work to keep transmission low. So officials say, let's remove the mitigations because they've worked.
Yeah, I think that relates to another mental model, which says basically that what I see is all there is, in a way. So it's sort of like this this idea. Many people had this idea that war is over. We haven't had a big war in 50 years, so there are no more wars. And there was this, I don't remember who it was, but who said it, that we are the United States of amnesia. We learn nothing because we remember nothing, or something like this. I thought that was a very funny way to put it. But yeah, so I think sometimes people get really caught up in in the current events, and then like history gets forgotten immediately, or we think that history doesn't apply anymore because it's different now. And so yeah, it really makes things difficult, because any learnings from past variants, if a person doesn't, if a person has a view that they want, how they think that public health should work, they can always say that with things we learned during Delta, oh yeah, oh, that was bad, okay, sure, but that doesn't count anymore because this is Omicron. And then, oh, we learned this and these things during Omicron, yeah, so we need to change this and this. And then they can say, oh yeah, well, but that was during Omicron, that was like 5 variants before, that doesn't count anymore. And so we can really, it's very easy to argue that history doesn't exist or apply in the current reality.
Yeah, thank you. So it's a shared sentiment, indeed. A question from Yunir. Could you comment on the way many of the experts in biological science, disease, and medicine consider their understanding of social system response to be science? Yunir, you can feel free to.
Matti, you don't have to feel yourself put on the spot to answer it. Maybe consider.
Well, I'd like to make a comment on the, because it's interesting what we noticed in the beginning of the pandemic. We were, I don't know what's the word, if you have a similar word in English, but people were in Finland. People were accused of being these couch epidemiologists, and so anyone who is not an epidemiologist doesn't have the right to comment. But on the other hand, epidemiologists have the right to comment on all the other fields. So no one said that, oh, hey, you're playing the kitchen psychologist now, and you're making assumptions that belong to psychology. Is that your training? Or so the multidisciplinary talks were very sort of difficult, and we know, and it seems that like if you're a medical doctor, at least here, people really, really trust you to know everything about everything and more. And so that's many people use that to that sort of how would you say, the prestige to back up their opinions, even though they are not doing research on the topic. And I'm not saying that you couldn't talk outside your own field, but it's just that there are there are people who don't have a field, so to say. If you're grown up in a very siloed idea of science, and you think that, okay, so now we go and ask this silo, and they will give us the answer, and the economist will give us the answer to this, and the economist will say, oh, I get the right prediction, but there was an earthquake that I'm not a geologist, and so that's sort of I think it's very important to include people from many disciplines, and not just put them on the same table and have them talk to each other. So I've been writing one paper with a physicist for 2 years, and we're still trying to find the right words to discuss sort of the same topics, because we are looking at the same thing from different angles. But the language barrier can be very difficult. So you need to build these interdisciplinary teams that have a history of cooperation, so they know how to speak to each other.
Good points. Thank you. All right, we have a question here from Wendy. How many schools in Finland, we're talking, how many schools are encouraging kids and teachers to mask up? And what is the general feeling there? Because the mortality rate is increasing quite a bit. As you are close to the Swedish strategy now, is there any kickback that the restrictions are being lifted too soon?
I haven't looked at, well, number one, our data from schools, the data that is being collected, there really isn't any publicly available, at least. I don't know if anyone is actually collecting the data or not. What I'm seeing from our population studies is that people have been loosening their precautions. And, well, when I say people, I'm obviously talking about some portion of the people, and we don't know actually from these surveys, we don't know how big a proportion of the population will drop all precautions soon, and how many people are sort of intransigeable, so that they will never stop wearing a mask. And I think that provides a hard bound on how the mask wearing is going down. It's been going down quite substantially, but still over 50% of the population is wearing masks in public spaces, and feeling very positive about this. What I worry about is that there is the feedback effect, so that you look at a space and there are less masks around. So you're sort of you haven't felt too strongly about masks, and so you leave your mask at home. And then when the next person comes, they're like, oh, well, there are not that many masks here, and so in that sense, the cycle keeps on accumulating, and you start losing the mask. And then even sort of the very strict people who were like, I'm not going to, this is not okay, they can really, when they are the only person in the room, and the other people are looking at them like, huh? So maybe they will lose their sort of self composure. But of course, this can be solved by people having these cliques of people, and these pockets of people, and we know that the people are not homogeneously mixing with everyone else. So I think it will be very interesting. In Finland, the mask wearing rates have been quite high, and they haven't gone down in the same way. So, for example, in the Netherlands, when you put on a mask mandate, it goes up, and then it goes straight down. Or in Norway, the same thing. But in Finland, it's stayed quite high all the time. But we see this trend downwards now.
We have a couple more questions. We're getting to the hour, so thanks for closing the questions. But we have a couple more, so thanks, everyone. So from Johnny Erickson, how much have gaslighting from the government affected precautionary principles on the people in Finland compared to what we had in Sweden?
It is very difficult to say about so gaslighting from the government versus gaslighting from all around, so to say. So we have the biggest newspapers here have, or like the biggest newspaper or the formerly best newspaper, Helsingin Sanomat, they have a very interesting take on the pandemic, and they have been for a very long time saying that the pandemic is over, and that this has been going on like more than a year already, and other media also. So they are sending this message, and there are some infectious disease doctors who are in quite high places who have been saying for a very long time that this pandemic is over, or at least a couple of months away to end. And this is part of the amnesia also, so that I don't understand how come the media keeps on interviewing the same people about the same things, who are saying the same phrases that they have been saying for the last 2 years, that hey, we're almost out, we should actually stop precautions because it will help us go out, exit the pandemic faster. And it's I think in our I think this is a sort of I haven't spent a lot of time speaking to the official people in the National Health and Welfare Agency, and the press appearance. It's hard to say like what actually they think or what they hope, and what is part of the press just making them like titling and headlining the stories very interestingly. But I think in 2020 we were in a very in the brink of going the Swedish way, and I think many people were quite unhappy that we didn't follow Sweden back then.
We have one final question, and then I'll be turning it over to Ynir for some final remarks to close the meeting. So our last question from Sinead. Are you hopeful about the better application of behavioral science to leaders' decisions for future crises and pandemics, and why?
I'm hopeful about the better application of behavioral science to leaders and decision makers for future crises and pandemics in Finland. I don't know what other countries. I know what other countries are doing, but I don't know whether they have long-term funding, or whether they are able to sort of get into the decision-making structures. And because I know what I've been seeing in Finland is that people are really open-minded and about our work, and people are feeling positive about this. And of course, because I know what we're doing, so I also know that what we're doing is positive. So I think I have a conflict of interest here, but more and more of these behavioral units are being built into governments, and there's more and more criticism of the old way of behavioral science advice that was exclusively focused on nudges. And this is also something that comes up in talks with government officials all the time, because people usually want to know, what is a good nudge for my situation? And I'm not that big of a fan of nudges. I think they need to be really considered very well, and about the situational factors are really key to whether any of that will work in the first place, not to mention the unexpected side effects and all of that it can bring about. But in that sense, I think there is evolution in this behavioral science advice.
Well, thank you, Matti. This was a great presentation and an awesome discussion. Thank you so much, everyone, for taking the time in the middle of your day or evening to come join us. If you were not already a member of the WHN, we encourage you to become a member, and one of our staff will drop the link to join if you're not an official WHN member. We will be sharing this recording out on our Slack channel and on our social media channels. So please look out for that as well. I'm going to turn it over to Yanir now for some concluding remarks. Thank you.
So first of all, let me echo the applause. It was an outstanding presentation, really very much appreciated, with an important perspective. And again, I think for whatever reason, it's been hard for people to realize that this is the problem, the challenge that we're facing is not essentially that of the disease. It's how do we react to the disease. So it's really very much a human societal challenge, and understanding how we can mount a response has to be a collaboration between understanding the disease and understanding how we respond to it. I think you've explained that and described it outstandingly. And I'm very appreciative that you pointed to the multidisciplinary nature of what we're doing. And I just want to remind everyone, if you're not aware, that we have multiple teams in different domains that welcome the multidisciplinary talents that everyone has. Everyone is welcome to join. We have teams in communication, in science, of course, in platforms, so the technology, also in how to grow organizations, and also in, of course, community empowerment, leadership in communities, and finally, we have a science literacy program. These are the broad domains, but there are many sub-teams that are present, and more, of course, that we should be building to address the challenge. Everybody is welcome to join and find out about all of the activities and find a place where they can contribute. Thank you very much.
Yeah, thank you, everyone.
Thank you, Matti.